You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey vet rehabbers, unity in the veterinary rehabilitation field. This is such an important topic, guys. Carrie Adrian and I chat about why it's so important, where we think the problems are, and how we can address this really important issue. This is a global issue, and we, the vet rehab community, need to come together on the 14th of November at the Vet Rehab Summit. It's Online Pet Health's annual virtual conference to brainstorm how we can achieve unity in our field. It's important for the growth of this profession, and it's also important for our patients, guys, because they need all of us, and together we are stronger, and together we can all have the best outcomes. If you have not signed up yet for the Vet Rehab Summit, you can go to vetrehabsummit.com. There is a free limited access pass, and this gives you access to the Unity discussion room, all of our amazing exhibitors' virtual booths, as well as a choice of one of our live webinars. You can purchase access to the rest of the summit also, which includes 21 hours of CPD, and of course, if you're an Online Pet Health member, you get free VIP access to the conference. So let's head over to my chat with Carrie. It's always such a blast chatting with her. Hey Carrie, thank you so much for joining me.
Good morning, good afternoon, good evening, everybody.
Carrie, for the listeners, won't you tell them about yourself and how you got into the field of vet rehab?
Sure thing, Megs. Thank you for this opportunity. This is a great topic today. My name is Carrie Adrian. I'm a human. That's my standard joke, I know. I'm a human physical therapist. I've been working with animals for just over 20 years now, and honestly, never go back to people. So I've worked with VCA animal hospitals for a very long time, direct rehab for VCA, and came out with a PhD in dog walking, canine biomechanics from Colorado State. I hail from Colorado, enjoy the outdoors and everything that goes along with it, and have a beautiful family, husband and 2 little boys, and that's my life, animals and kids.
So Carrie and we've been friends since 2016, since that IAVOPT conference in Sweden.
Yep.
Yeah, so we're walking between 2 of the halls, basically, and we've gone from one lecture to the other, and I'm next to Carrie, and I'm chatting away to her, like, make friends with her, and we get to the hall, and I'm like, oh, I'm going to go sit, and she's like, yeah, I need to go up here, and I'm like, okay, so I thought, hopefully meet up with her again. She was really nice. And then the next minute, she's standing in front of us, and she's the lecturer, and I nearly fainted. I thought, oh my gosh. I was like speaking to the lecturer, and yeah. And then we've been friends ever since.
Fast friends, for sure, yes.
So we chat on the phone a lot, and we had this conversation about the Vet Rehab Summit. And, one of the discussion rooms that we're having at this year's Vet Rehab Summit. So for those of you that don't know about it, it's our online veterinary rehabilitation conference. It's on the 14th of November. And Carrie is obviously going to be there. She's going to be chairing one of the discussion rooms, which we'll chat about a bit later. But this one in particular is on unity and unity in the vet rehab profession. And so Carrie and I it must have been like an hour conversation about this. And afterwards,
just a few months ago.
Yeah, I said, we should have recorded that. That would have been a great podcast. Yeah. So here we are back again, and we're just going to have the same conversation, and it'll probably go in different directions. So Carrie and I, when we start talking, it's really hard to get us to stop. We can talk forever.
Thank goodness for WhatsApp, right? Thank goodness for WhatsApp. That'd be a big bill. Yeah, I think this is a really important discussion, and we've all had it at some point in our career in animal rehab, and I think starting out with the term unity in general, Megs, and what's your perception of that? Where do you see us now and needing to be in this field? And what is your perception of unity?
Yeah, so for me, I see all these different professions coming into our field, and everyone has all these diverse backgrounds, right? And everyone has something different to offer. And, I don't think that there's one person that should be treating animals. I think it should be everyone, and it's a team effort. And everyone has whatever they're bringing, and whatever they're going to bring to the table is going to be what they can offer the best outcome for animals. So you have an animal, and for me, whenever I was treating animals, I knew what I could do. If there was a patient who I believed would be better off being seen by someone else, I would refer them. And I used to have in my practice, I had a physiotherapist there, I had a hydrotherapist, and it was never just one of us treating a patient. It was all of us. And it's this collaborative, we need to collaborate together for the best outcome for all our patients. And that's what I believe, is that everyone needs to come together. So for me, when I think about unity in our field, I think about the vet rehab team. That's what it is. It's a team. And I know that it's not always that we have basically a clinic where we can have all those people under one roof. And it doesn't mean that we have to have that. You can have a standalone person doing veterinary physiotherapy, another person doing hydrotherapy somewhere, a vet doing something else, acupuncture, whatever. But if you work together and you refer together, so let's say you think, well, maybe I'm not managing this dog's pain as well as I should be. Maybe it needs some acupuncture, and you refer it to the vet. Or this dog needs hydrotherapy. I don't have an underwater treadmill. I'm doing all these treatments. Let me refer it and work together with the hydrotherapist down the road. For me, that's how I see it.
Yeah, and I would agree with that. And and I look at this and say, where are we going wrong? I just don't see that in my experience, especially here in the States. We've had some battles. I would not call veterinary rehabilitation in the U.S. unity by any means. And we've had our battles. We got lucky in Colorado. We fought hard for 4 years to get our own Practice Act changed from, what's the definition of physical therapy was the practice on human beings. And we actually worked with our physical therapy state board, and of course they're different, across the board. And it took us 4 years to change my own definition of physical therapy from human being to client and patient, which then would include animal. The beauty of that was we had the blessing of the veterinary board. We asked them to give their input. We asked them to be part of these discussions, and they did. Unfortunately, we don't see that across the board. There's a lot of misinformation, if you will, especially, I don't know if a lot of your listeners are abreast of California and what's going on there. Of course, everybody's having their own struggles, but there's a ton of misinformation that's being spread. And it's fear. It's, hey, the PTs don't want the vets involved in rehab. Hey, the PTs don't think that they need to be qualified to practice on animals. There's so much fear and misinformation being spread out there. And honestly, it blows me away. Like, how can they read this proposal and come up with this information other than trying to fear and keep us out of animal rehab? And it's sad. It's really sad. And the other thing that comes to mind, because, I think the avenue that we've taken, the model that is in veterinary medicine now compared to the human model is so different. So I worked with a team, when I was going through physical therapy school, and I had clinical rotations on an acute care floor. We met with a physiatrist. We met with the respiratory therapist, the occupational therapist, the physical therapist. We all literally sat at a table and rounded on every single patient. It was phenomenal, absolutely amazing. So under this umbrella of rehab, we had all of these various licensed rehabilitation professionals. And I look at this, and the difference to me in vet med is we never really had, the difference is the veterinarians wanting to do what we do. And yeah, that may ruffle some feathers, but it's a very different model. Now we have the sports medicine and rehab board certification. And I'm thinking, where are they getting their rehab education other than these 40 hours of continuing education? I'm a licensed professional. I went to school for 7 years, to be a physical therapist. I don't want anything to do with vet med. So I think therein, is part of it. The human model, everybody has their place, exactly how you define unity. And we work together for the benefit of the patient. And I see this with Veterinary rehab is now the veterinarian, wants to do rehab. The technician wants to do rehab. So I think that's where some of this collision comes in. And frankly, I think it's territorial, unfortunately. Is it money? Is it territory? They sometimes I think they forget, where are you learning this? It's from physical therapists. And it's a very narrow portion of what we learn. And that's very frustrating to me as a PT, because, who's sponsoring these courses? Modality companies, right? So what do the vets and the techs learn? Modalities. And that's what they see as being rehabilitation. And it's scary. It's really scary.
So if we look at the veterinary field and you go maybe like 30 years ago or so, vets weren't specializing then. It's only a new thing that we've actually started to specialize. But the vet did everything with animals, right? So you went to the vet was the skin specialist, the heart specialist. He or she did the cesareans, the orthopedic ops, everything. The one vet did everything, okay? And so like you're talking now about that whole team where you have all those different people. In the veterinary world, I think we're a little bit behind in that regard. And so what happened now is the vets have peeled off into their own specialities. And so the vets are still only referring to vets. So there's a shift that needs to happen where we need to be looking at other professions that might be coming in. And it's not only veterinary rehabilitation. Maybe, for example, animal nutrition. That might be one, that's a prime example of something where I feel my veterinary degree didn't prepare me for. I mean, I had a little bit of nutrition knowledge, but I never came out there feeling like I had a real handle on nutrition. And there was lots that I had to learn after I'd qualified. And so there are all these different things maybe where I feel that vets, we can't be everything. We can't.
Right.
And there's a shift that has to happen with regards to referring. And they have this mindset that we refer to another veterinarian. And maybe that's where this whole thing comes with, keeping everything to themselves. But, I think that even the vets that are out there that are doing rehab, they have a place. They have a place in rehab, so a vet could specialize in rehab. But if there is a vet, that vet can do certain things, right? According to what they've studied and their experience, and how I said, in my practice, I was very much the person who was doing the diagnostics. There were a lot of things that I left up to the physio, and, I wasn't involved in any of those kinds of treatments. So that the animal would come in, I would diagnose it. I would discuss with the physio, what is our plan? I would do acupuncture. I would do homeopathic injections if I needed to. I would do some of the assessments where needed. But the physio was doing most of the treatments, and the massage therapist and the hydrotherapist. And then it would come back to me if there was a problem. Let's say the dog,
you're the case manager,
was off its leg, again, like Megan needs to check what's going on, and to be honest, most of the time the therapists, they knew what was going on, but I had to be the person, because I'm the vet, to confirm it or say, okay, I'm going to refer it back to the primary vet. But what I really think is that unless we can get unity within our field, okay, with all our different professions, it's going to be very difficult to get the unity with the vets, because one of our biggest problems is we are struggling to get, and this is a global problem. I obviously speak to so many vet rehabbers all over the world. It's a global problem getting vets to refer cases to them, because of this fact where vets are referring to other veterinary specialists. It's new for them to refer to a hydrotherapist or to refer to a veterinary physiotherapist. But unless we can unite and start actually referring to one another and supporting one another and be unified, how can we expect them then to support us? It starts really with us all within the field. And then, for me, what we need to be doing is to be establishing and building relationships with the vets. And for me, it's not just the vet who's in rehab that's included in the vet rehab team. The vet that refers, there's a vet and it's a primary veterinarian and they're referring to hydro and referring to a veterinary physiotherapist, they're part of the vet rehab team. So they're included in it. Vets, even if they don't have any qualifications in rehab, are part of that team. We're all a team all together. And so, yeah, I mean, I really, really hope that at Vet Rehab Summits, we can all come together and come up with some solutions as how we globally, because I think the problem is right now we have all these little individual people that are trying to sort of sort this unity issue out, all different places all over the world. But it's a global problem. It's not actually just a problem in California.
It'll be a great, it'll be a fantastic discussion for the summit, Megs. And, you know, I go back to your comments and that's how I envision this unity happening as well. You know, the veterinarian has to be the case manager, and whether that's diagnostics and joint injection, and, you know, now we're doing all these needle scopes and musculoskeletal ultrasound and PRP, and, you know, so some of the higher diagnostics and treatments are, and the oversight is done by the veterinarian. You know, collaboration is not new in general. You know, you look at engineers and doctors, and, you know, there's so many various collaborations out there. And I think you're right. I think the veterinarian is used to referring to a veterinarian. They don't really understand who we are, you know, as a licensed professional. And I think part of that, at least the experience that I've had, is the liability aspect of it, right? So if you're referring to me, what does that do for your liability? But, you know, ultimately, and again, this is part of the big cluster, is that liability taken off of you and now under my professional license. So there's a lack of understanding, if you will, to be able to refer to another licensed professional. You know, they're used to working with technicians, and you know, most of those have an associate's, maybe a bachelor's degree. So there's no true oversight with regulatory agencies. And that's something that vets are not really understanding. But if you look at this as well, most of this comes down to education. And you know, I think we've talked about this in depth, that in Italy, you know, I'm having conversations with some veterinary friends from Italy, same type of deal, that, hey, I'm a physio, I like animals, I want to work on dogs. Well, you know, it can't work like that. Or some person off the street doesn't want to go to vet school, but wants to be, you know, a hydrotherapist. There has to be a standardization. There has to be some degree of understanding of what a hydrotherapist does. What is a tech allowed to do? You know, what is a physical therapist allowed to do in this field? It all comes down, in my opinion, to education and legislation. And you know, technicians even, it's a gray area here. We even had one of our own PTs, you know, tell these technicians, if you're going to evaluate and treat a rehab patient, don't call it an evaluation, just call it an assessment. And it's not right. You know, you can't just change the term, because you're still practicing outside your scope of practice. Just because you're certified in rehab doesn't make it that you're able to now evaluate, develop a plan of care, progress a plan of care. So it's still gray in our neck of the woods as well. And if anything, these organizations, I believe, are making us even more divided. Yeah. You know, we have the sports medicine and rehab, and I just, for kicks, I wanted to, hey, you know, I've been part of their journal club for a long time. Well, the current moderator caught wind of it, and now I'm no longer part of it. You know, so the divisiveness, and I wanted to, you know, watch some of the webinars. No, sorry, it's just for, you know, ACVS and more students. Well, you know, they're segregating us. They're causing more and more of this divide. And I feel like, okay, you know, we want to learn from you, but we don't want to work with you. And that's the impression. No, but that's where I think that IAVRPT, you know, is a phenomenal conference, and you know, your summit and just OPH in general, you know, brings us together and forces us to talk about the difficult subjects, and it's good.
Yeah, you're so right. You know, because what's happening is everyone is forming their own little conglomerates. Yeah, and it's all like, if you're a PT or if you're a vet, and that's the great thing about the IAVRPT, is that it's actually everyone. So this is an international association for everyone.
Right.
And I would really encourage any of you guys that are listening that aren't members to have a look at the membership and become members, because we really need to. This is what we need to do. We need to grow the field in an association where everybody's welcome.
Mm-hmm.
Going back to chatting about the qualifications, you see, I think this is one of the issues, is that the vets, right? Let's say you have a primary vet, they don't know what all the different qualifications are, because let's be honest,
Right.
I mean, there are just so many different ways in which you can get into the field. And
Certification for this, that, and the other. What does that mean? No wonder they're confused.
Yes, I mean, I'm confused.
Yeah.
I
am too.
Looking at all the there should be a path that you have to go on, right? So all these different certificates, they might, and especially if you don't know, the vet doesn't know what the primary studies that person has done, because often it'll just have, numbers from another country or whatever. It's so difficult to know what the qualification is. And maybe this is part of their hesitation in referring. And it takes them a while until they build up trust with a particular therapist. And then eventually they do start to refer. But I mean, this is a whole nother conversation. And maybe it's part of the unity conversation, is that how can we globally have a way in which we can say, well, this is the criteria. This is what you need to have in order to treat animals in this way. Because, there are massage therapists. There are weekend canine hydrotherapy courses. This is the problem.
Right.
In parts of the world, you can go for a weekend or 4 days and do a course. And then it's like a level of a canine hydrotherapy certificate. But then you're like level whatever, 1 or whatever it may be. And so how would the vet know, and how would the pet owner know? Is that an adequate level to be able to be practicing or doing anything?
And that actually just kind of turns a light bulb on for me. So why aren't these standards through IABRPT? If we're such this international group, perhaps the definition starts there and trickles down. This is what we envision, to help all of these countries come to terms with all of this, and to really define roles of each of the professionals. It's kind of like, duh, this makes sense to me. That the standardized, of course, legislation typically follows, it's usually lagging behind too. But, to me, it makes sense that we have some degree of standardization or understanding of what everybody's role is. And IABRPT makes the most sense to me to help us define some of these roles.
Yeah. Well, the IABRPT is actually chairing this meeting now, this discussion room at Vet Rehab Summit.
Awesome.
So, I mean, we really want everyone to be there. So guys, this is the Vet Rehab Summit. There is a free limited access pass, and this discussion room on Unity is available to everyone. So you don't have to be an online Pet Health member. You don't have to have a paid access ticket to the Vet Rehab Summit. Anybody can come online that is in the field and if it wants to participate and give their suggestions, because we don't have all the answers here. I mean, this is really going to be a discussion. Like, how can we overcome this problem of lack of unity in our field? Because it's affecting all of us, and it's causing a lot of angst for people, and there's a lot of energy spent competing and fighting against one another when we should just be uplifting one another and just working together.
Which is where the research, the plug for the research will come in. I mean, that's where we should be expressing our focus. But I think that's brilliant to have the conversations and to have the tough discussions of why. Help me as a physical therapist understand why you don't want us as part of the field. Help me understand how I can educate you or work with you. Or is it money? Is it turf? Is it that you feel we're not, educated well enough? Is it, what is it? Help us understand so we can work through some of these dilemmas. And in my experience, in looking at some of the issues that I've talked to a lot of people over the last 20 years, a lot of it is a lack of understanding, it's education, and it's legislation. That's just my perception of it all. And that's usually lagging behind.
I think we need to sit and we need to get basically a list of all the things, like you say, what are the problems? And once we have all of those, then we can address them all.
I
Because
think
once
that's great.
there must be a whole lot of things that people are questioning and then they don't have the answers for. And hopefully all of us together on that day can come up with a plan. And what I'd really like is like a working group to be formed that can then facilitate this going forward globally. So we have representatives from all over the world. We come together on a regular basis and say, okay, like, what are we doing? And, you know, that's where a lot of the things that we're doing at this year's Vet Rehab Summit is really about unity. It's about this trying to get all of us to work together. So, I mean, in the very beginning of the Vet Rehab Summit, the first thing is around the world networking rooms. So we basically have one room where we're all going to come together. I am going to be talking about how to collaborate, how to network, how we can work together on a social media front, how we can work together to promote one another and basically collaborate. And you can be in the same area, and you can be in different parts of the world. And you know, and then we're going to section off into areas, and then people are going to meet one another and talk to one another. And I've seen this happening now already. You know, once a month at the end of the month on a Friday, Carrie would love you to join us if you can. This
Sign
month,
me up.
if you can. We have Coffee with Megan, and it is amazing. I mean, we have between 6 to like 24 people. So at one day we had 24 people online. Coffee with Megan last Friday of the month. And it's an amazing group of vet rehabbers that are coming together and are actually taking action on things that we're discussing. So we had this discussion about people going on Facebook Live. This is a prime example. And, you know, everyone was saying, oh, but I'm so scared to go on. So I said to them, well, go on with somebody else. You know, if I look at when I do podcasts, I mean, it's so much easier for me to talk to somebody and have a conversation than it is for me to sit and and you'll see from my podcast, I think I've maybe got 4 where I've gone solo, and they take about 10 times as long as the ones when I have a conversation with somebody. And it's so less daunting than being like the center of attention, because if it's you in a Facebook Live and it's just you talking, so they decided, I said, find a friend, like right now, choose somebody here in the room and say, hey, will you go on Facebook Live with me? And so there are people that are in South Africa and people in England are now doing Facebook Lives together. So they do similar things. The one's a vet tech, the one's a vet physio, and they're talking about what they're doing. They're talking about their cases, and they're helping to spread the word of vet rehab. And by doing this, by collaborating and working together, this is how we're going to grow the field.
It's little clinical pearls. You know, it's just, hey, what are you doing for this? Just that one little clinical pearl that I changed in my practice that could help how many thousand? I mean, this is one good thing of social media, right? You know, is being able to share from all over the world. I love that. All right, sign me up. I'll be there. That'd be fun.
We'll be there, So, and I mean, and if I look at the communities that we have with online pet health, you know, it's amazing the unity that's there. You know, there are all these people from different fields and everyone's supporting and helping one another. And really that's what we need. You know, if I look at, you know, another one of the problems that we have is that there is this lack of awareness about what we do, okay? Because everyone, each individual person is so focused on what they're doing instead of we're focused on what all of us are doing. And this is what we got to do is like, let's imagine if every single person who's in vet rehab started working together, and we had this it just blew up on social media about, you know, how we're working together and how what everyone can do and what they can offer animals. It would just go crazy. Every single vet, every single pet owner all around the world would know about veterinary rehabilitation. It would grow the field too. Massively, right?
It would completely, but that's the hard part too. And I don't know about you guys, but I'm finding this too with all this COVID stuff now. Everything's online, right? And for me, it takes how much longer to sit there and go through a CE course. And now everybody's online. So you have to be able to pick and choose. And there's, on any given day, probably 100 lectures going on animal rehab. So I think it's becoming, you know, even more diverse, and what do I choose to spend my time on today? And that's a decision every single day, because you could get lost in the amount of information that's out there.
Yeah, for sure.
And it's getting worse, in my opinion. Not worse, but just time wise, it's really hard to pick and choose.
But there's still loads of pet owners that are out there looking for information. And so this is what I'm talking about. It's like being there for them, So putting out information, because like if I think about other fields, right? There are so many blogs about, let's just look at veterinary, okay? If you look at all the blogs about veterinary, how many blogs are there about vet rehab? Not that many. You can Google it. There are hardly any. Vet rehabbers are just not doing those kind of things, and so we got to be doing them, and we can do them together. Really, that's what I want to say. Is we can do them together. Sure. And we can help each other out.
100% agree, and unfortunately, that's not the direction that I see it going. What, in your opinion, too? What are some of the issues that you've run into that are trying to break this unity?
Yeah, I think that, the biggest thing I think is the vets, right? Not understanding what vet rehab therapists are able to do. I think that is the biggest problem for me. They don't understand what we can do, and they don't know whether they can trust us. Because for them, if I put myself in a vet's shoes, right? So if I go, if I wasn't a vet rehab therapist, if I was referring to somebody else, okay? And like you say, I'm potentially liable for it's not even about the liability. For me, it's about the patient that I'm responsible for. I want to do whatever's best for that patient. And for whatever reason, they do not believe that referring them to a vet rehab therapist is in the best interest of their patient. Otherwise, they would be doing it.
And just to interject on that subject too, I also don't think they understand not just who we are, but what we can do for their patient. Whether that's, fitting for an orthotic. And I mean, there's another collaboration right there. Working with occupational therapists and CPOs to develop orthotics, it's a whole nother collaboration with engineers and biomechanists and, just a point aside. So being able to, incorporate and understand how we can help their patient is a huge lack of, and I believe why we don't get referrals, because of the lack of trust and the lack of understanding.
So I did a podcast with Lilani Alvarez, and she did actually a study looking at, did you listen to it, about the perceptions basically of vets and them referring. And, what basically came out of the study is that we need to educate vets. That's really what we need to do, is we need to educate vets on what we are able to do, because they didn't get the education. They didn't get it. And I didn't get it I qualified in 2001.
But it's only this much education even, so I even feel like what the vets know is this much of what movement analysis and biomechanics are all about, and that's where I probably, get a little bit frustrated, is it's not just modality, and that's what's being taught mostly throughout the world, so understanding, I see the same exercises prescribed to every single patient, and everybody talks about it's a strength issue, so it's not just strength, it's movement, and it's functional movement. And how do we identify that? So, even the vets that are doing the rehab now, it's such a small portion, of what rehabilitation and physical therapy can do for these animals. And my other struggle is, how do we get that out to the masses as well? We need advanced, information. We have to be able to somehow expand knowledge in the field across the board. It's very limited.
Two main areas. The one is the vets, and then the pet owners, right? Once we educate the vets, they will also help by educating the pet owners. But we got to do the two, because we also have the pet owners going to the vets right now. I mean, there are a lot of pet owners that are looking up on the internet and finding information about what we do, and they're going to the vets to tell them. So we've got a two-pronged approach really, and this is where this around the world networking comes in. It's where we need to be educating both. So how can we educate vets, and how can we educate the pet owners? And we can do this using social media. We can do this doing lectures. We can do it by writing articles in veterinary magazines. These magazines are all looking for people to write articles on. You know, they're always looking for content.
But you know what I see in every article?
Yeah, what?
Laser, underwater treadmill, acupuncture, that's rehab. Every single article, and I save them. I could probably pull out a stack that talks about in therapeutic exercise.
Yeah. So we got to change that, right? So we got to be the ones, and this is where we got to be the change. Okay. So we can sit back and say, oh, we're seeing all of this, but then, you know, the people that are in the field, if they want to have a different perception from vets, you know, if they want vets to perceive them in a different way, they got to be the ones to do something about it. And so in your area, so if you live in Slovenia, whatever, you know, you got to be the one. Like if you want to get vet referrals, you got to be the one to say, hey, I'm going to write an article. And, you know, the one thing I want to say about writing articles, you know, I used to think, right, when I used to see articles, I used to think that those people were chosen, you know, they were chosen because of their speciality and their experience to write that article. And then I realized, well, I'm just going to ask if I can be the chosen one, you know, and every single time I've ever asked to be published in a veterinary magazine, I just write and say, I'd like to write this article. And then I get published in it, you know, and that's the thing, is there's this perception. So people think, and the vets think, right, this person has just got published, this veterinary physiotherapist or this vet rehab therapist has published an article in this veterinary magazine. They must be good, right? They must know what they're doing. And that's where the credibility comes from. So now you start to they start to trust you. They think you're in a credible magazine. You've been published. You must know what you're saying. And you start to become more credible to the whole veterinary world. And then they start to refer more to you. So these are all the things that you know, I want to share at this Around the World networking, about how we can, and once we build that credibility and we get that connection, that's when the vet rehab team starts to form, you know, that's when we start to, because once they trust us, then everyone comes together. We have the vet rehab team where they're referring to us, we're referring to them, and then we start to bring all the other professions into that circle of trust that we have, you know. And
I understand you, and you understand me, and it's down, you know, on this lower level. It has to be just what we're doing today. You know, the face-to-face, I know you, I trust you, and let's continue to progress the field by pulling in, you know, this information. You're absolutely right. It falls on every single one of us to work together and to educate. Don't just sit back on your laurels, say, hey, I'm going to let somebody else do it. And here and again, you know, where do you spend your time? And if the divide and conquer always works. You know, so if you write half of it, I write half of it, guess what? We have a full article, you know, in half the time.
Yeah, exactly. So you, I mean, you could collaborate with somebody in your area, or even somewhere on another part of the world even, you know, and get it published and share that. But we got to work together. That's what it is. And that's what the unity thing is all about. It's like, how can we work together to grow the field and for the best outcome of our patients? It's about the animals. What is best for them, you know? And I really want to challenge every one of you guys that are listening, you know, when you have a case, all right, think about what is the best thing for this animal right now, you know? And if there is somebody out there that you think would be best to treat them, you know, then you need to refer to them. I mean,
know your limitations.
Yeah.
You know your limitations.
How much that you can do, and it's okay. It's okay. And everyone is scared they're going to lose that patient. The thing is, you won't. Okay, you won't lose the patient. That owner will respect you so much more that you said, right, this is how much I can do. I really think that it'll be beneficial for Fluffy to go see Carrie Adrian too. This is what I think she can do. And you'll be surprised what will happen is that client will still come to you and it will still go to see you know, like, and that's how it works.
case in point, I just had one. I was talking with an anesthesiologist. She's not boarded in sports medicine, but I work with her and with one of my surgeons. And the three of us have brainstormed last week on a patient that's just terrible bicipital tendonitis, just terrible. The biceps isn't even stable in the groove, and it's 60% torn, on ultrasound. And I'm working with this dog, mild increase in activity. The dog's painful on palpation, crying out, biting. And it's just, I don't feel like I'm getting as far as I need to be 2 months out. So I went back and consulted with both of the veterinarians that I'm working with and gave this client 3 options. It's shockwave, it's PRP, it's surgery. And then after, it's going to come right back to rehabilitation. But at this stage, I recognize, okay, we need to intervene here. Something's not working, something's not right. Pull in your team. Let's powwow. Let's have that conversation and get Coco Bear better. And that's where we are. And it's up to the client. Again, the respect is there because my goal is to get him better. And I don't want to waste your time and money. And, I'm not going to push this out any further. We're not advancing the way we should be. Let's regroup on this. And it works brilliantly. Yeah. Everybody's happy. Client's happy. Surgeon's happy. So there's no doubt a need for additional communication with all of this and understanding of who you are and what you do.
Yeah. Love it, Carrie. So we're going to carry on this conversation at the Vet Rehab Summit, guys. So please, you can go to vetrehabsummit.com and sign up for free, buy a ticket, be an online Pet Health member, even better. Online Pet Health members get free VIP access to the Vet Rehab Summit. Come and join us. This is an important day, guys. There's so much stuff we're going to tackle. Carrie actually mentioned the research. So on top of everything else that we're doing and the networking and all of that, we've also got a research and discussion room. And, one of the things that we've realized is that we are lacking in research in the vet rehab. And this, Carrie, actually, thinking about this might be, one of the reasons that the vets are not referring to us because we don't have that much research to back up what we're doing, right?
Well, that's a good point.
So at this discussion room, we are going to be creating another working group, a global working group. And we're looking at, one of our biggest problems is that we don't have the funding to do a lot of the research. And so we're looking at doing some clinical studies and clinical research. And the problem is that with these kind of studies, a lot of the time we have very, very small sample sizes. So we want to collaborate, again, everyone globally. And let's say somebody comes up with some anecdotal idea, and then the global working research team will basically put that together, have a chat about it and say, this is something that's worth us carrying on about, and put together a study where other people, it doesn't matter where you are in the world, you can be involved in. And we want all of you guys to be involved in.
Yeah. Kiki's going to be great with that. Kiki's phenomenal. Yeah.
Kiki Hausler is chairing this. She is the instigator of this. I had a podcast with her and she said, this is what we need to do. So she was the one who actually instigated this whole thing, and we're just putting it together and facilitating it at Vet Rehab Summit. So,
love it. So all you research nerds, join us.
Yeah. Carrie will be there for sure. Hey.
Are you calling me a research nerd?
Oh, you're a nerd. I'll just call you a nerd.
I love it.
Awesome, Carrie. Thank you so much for your time.
Thanks. Thank you.
I will see you on the 14th of November.
Yes, ma'am. I will be there. Thanks so much.
Oh, we forgot to talk about your natural balance. The one that you carry. So, of course. So my topic for the Vet Rehab Summit is on natural balance, which I think is a huge conversation. And I actually remember I was talking about, I think it was in Sweden at IAVRPT, and I was talking about compensation and, what's good compensation? What's bad compensation? Is symmetry a good thing or a bad thing? Do we always need to have symmetry? In dogs, I don't know about horses, but at least in dogs, it's called laterality. And it's very similar to us. I'm right-handed. Does that make the right side of my body, more hypertrophied? Or do I use the right side of my body different than the left? And how is that important in normal movement as well as abnormal movement? And if we see it, should we fix it?
what does that mean? So this is all the, talk about research and nerds, and it's so exciting and so intriguing to me because, we're starting to see more and more data. Oh, I better stop there. But you start to see asymmetry between muscle agonist, antagonist, and now we're starting to see, knee injuries because of that. So a whole topic, guys, of information on natural balance and laterality, symmetry at the Vet Rehab Summit. So join us for that one too.
Yeah. So guys, these discussion rooms are all live. There are no recordings to them. So it is a discussion. You guys got to be there to participate. So come
and bring
on
questions. Let's chat.
Yeah. Awesome. Thanks, Carrie. Awesome.
Thanks again. Take care.
Bye.
Bye.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. And please, if you get a moment, head over to Stitcher or iTunes and leave me a review. It's a really lonely job being a podcaster, and so the only time I get to hear from you or know that you're out there is when I get a review. And know that I read every single one of your reviews. So to those of you that have left reviews, I want to say a very, very big thank you. Every time we get a review, it really helps to get the Veterinary Rehabilitation podcast out there to all the vet rehabbers all over the world. All right, vet rehabbers, so if you are looking for more continuing education in the field of veterinary rehabilitation, head over to onlinepettalk.com. Go be awesome, guys.